طان محمد ميل 59 سنة يوم 28 يوم الأربعاء الساعة 9:27 الصبح. زين. إذا إيش عنده shortness of breath chest pain irritative شنو؟ إيش قص عليك تقوح؟ more than 1 month.
دكتور هاي لازم نذكرها يعني بالاي سي جي؟
هذا المفروض لما تقدمها الاي سي جي تعطيه شورت هيستوري حتى يعرف. زين. فاذا this patient is 59 year old. Last patient we examined just now. This is his ECG. He is complaining of shortness of breath, chest pain, irritative cough for more than 1 month. He is diabetic on oral for the last 25 years with severe hypertension.
For control?
For the same for 20 years. Blood pressure now was more than 200 over more than 110. Therefore, the blood pressure is severe. This is his ECG. His ECG, انتبه. His ECG showed, first of all, we look for the connection, if it's wrong or not. I mean by connection wrong, putting the right in the left and the left in the right, okay? And it is connected normally. This is the AVR is a normal, and we look for this amplitude. This amplitude, it means that the normal things, it's the apex. I mean the QRS must be higher in this region, like this amplitude. This QRS is more than the amplitude. While in heart failure, in hypothyroidism, you see what? A low amplitude. You see a small QRS. Then we look for the axis of the patient. This is in lead 1, it is positive, high R, while in lead 3, it is negative deep S. Therefore, this is a left axis deviation. Okay? Then we see if there is any LVH in this patient. LVH means left ventricular hypertrophy. LVH, sorry, in ECG, we look for the following. In the standard leads, I mean by standard lead 1, 2, 3, AVR, AVL, and AVF. In the standard lead, there must be a high R in AVL more than 11. Okay? And this is R is more than 11. Therefore, this can lead to a diagnosis that this patient got what? LVH. Okay? And then therefore, a high R in AVL more than 11 small square, it means LVH. The second one, if you get a high R in AVF more than 20, it is also good. Go with LVH. Any one of these can lead to diagnosis. There is a small R wave, but there is deep S in AVF. Okay, we get nothing from AVF. We look for V5 and V6. If the R wave in V5 or V6 more than 25 small square, therefore this is what? LVH. In this patient, it is more than 25, actually is nearly 30. This is a high R in AVF and a V5 and V6. The other way to look for LVH, we added deep S in V1 to the high R in V5 or V6, it must be more than 35. And this is nearly more than 40. Therefore, this patient got what? LVH. It means what? Severe hypertension, aortic stenosis, disease in the left side, causing LVH. That's why we get bilateral basal crepitation in this patient on the back. It doesn't disappear on coughing. It means that there is some element of failure in the left side due to the diabetes ischemia and due to severe hypertension. Probably he got a renal disease, renal problem. This is the ECG, and there is, descending of ST segment and inverted T. All these indicating strain on the left side. We see it in V4 and V5 and V6.